Hey guys, welcome back to another n8n tutorial video for healthcare. Previous video we talked about what did we talk about? Feedback management, using AI to do feedback management to get patients to do feedback, and we have automated way of generating questionnaires for patients to respond and even acting on responses which are negative or unfavorable. So in this video, we will share next on this thing called hospital bed management unit that uses an n8n workflow, right? So every day in hospitals around the world, bed sits empty while patients are in ED waiting for bed. And why is that? It's not because the bed is not there. It's just that it is just very hard to allocate beds out there because there are so many constraints to work with, right? So this video really dives into a lot of things regarding discharge planning and how to do proper discharge planning within the hospital. Either is it discharge before noon or even active discharge that really, or even this thing called a predictive discharge, which actually it will kind of like the AI helps you to assess a patient's readiness to discharge. It's a big busty word, but in that sense, here's how it goes, right? So first we talk about the manual trigger. So the manual trigger kicks off. Basically, it says that your bed manager just wants to see what is the current situation today, right? So it fetches the current list of patients in the ward, right? There's of course this little 6 a.m. discharge planning that kicks in. That this is your morning discharge run where it fires off. Some people morning discharge run is 8 a.m. for example. So it's not 6, it could be 8 a.m. It fires before the ward rounds. So the ward rounds is normally around 7:38, right? So by the time the consultant walks into the ward, n8n has already assessed every patient and has already published discharge recommendations in the form of Slack, right? And then that's where the next thing, the third point is the pre-discharge before noon. So in order to discharge before noon, you must have a note that actually tracks in the morning who is ready to be discharged, right? So and that's where your electronic medical record also comes in, push the necessary data and through the whole system. And then it goes through this thing called assessing discharge eligibility, right? And of course, if the patient is eligible, if the patient is eligible for discharge, then that is good, right? So then that's where we generate the discharge checklist. We notify patients in a way once it's eligible. I mean, this part needs a little bit of gatekeeping to make sure that the clinician or the care team must certify that the patient is eligible to discharge. Not AI decides. The care team needs to decide, and the AI will only help to generate the discharge checklist, and then we'll slowly need to start to prepare the NOK message. Not fire out, but prepare the NOK message. Separately also is to check on the bed types out there, because there are some wards that are gender specific, there are some wards that are specialty specific, there are some wards that are shared, MRSA, there are a lot of ward criteria in a bed management unit department. So then that's where they talk about bed matching, right? Because bed matching is super difficult because, of course, on a happy day, bed matching, if the bed can be allocated, that will be the best. And once we have allocated the bed, then you can do your housekeeping. But of course, more often than not, you have your unmatching of beds where the bed you cannot find somebody for the bed. And that's where the escalation protocol comes. And the escalation protocol is always currently still today WhatsApp. Me taking a phone, texting somebody to say, hey, time to discharge patient. I have a problem. I need to fit the patient into a bed. And there will be a lot of like musical chairs moving around. But actually, this whole flow really is n8n's handled, where you will receive a WhatsApp message automatically saying, hey, there is an unmatching bed problem now. We will escalate it to tier 1. And of course, if that happens, then we will wait to check the bed availability again. And all that happens here is if there is a bed found after tier 1 check, there's no need to escalate to tier 2. But if still cannot find a bed after tier 1, it goes to tier 2 WhatsApp, right? In that sense. So if all things are done, then it will just, if it needs to escalate to tier 3, it's a big issue, but more often than not, it goes to tier 2 at most. And of course, all in all, it actually checks the bed availability, and then it triggers housekeeping to really clean up the bed first before we can put somebody in. We write the audit report, and the whole flow is essentially done. So in a nutshell, this is the quick overview of how you use n8n in a hospital bed management unit, where the key crucial part here is the AI helps to assess discharge eligibility based on, and that actually speeds up your discharge before noon process and check whether the patient is eligible, informs NOK down the line once the doctor or the care team has certified that the patient is eligible for discharge, along with a generated discharge checklist, whereby you need to check whether there is medication, there is medical certificate, there is bills being paid. These are the little NOK is present to pick up the patient. These are the little generate discharge checklist that is super key, that actually delays most of the discharge process. Next comes the fine tuning of how to allocate the bed, matching the bed to the patient, especially when there is an issue matching because of gender, because of different ward specifications, different paying class as well. And this flow also shines based on the escalation process, where it escalates to tier 1, tier 2, tier 3, all the way down until a bed can be found. And once the bed is found, we will have the allocation process as well as the housekeeping efforts to come in to wrap things up. And of course, by then, the NOK would have already received the SMS for the patient to do visitor registration and to pick up the patient and have a safe discharge home. So yes, this is the overall flow. My name is Dexter, and I welcome any feedback or enhancements to this workflow for bed management unit using n8n workflow. As always, if you like the video, remember to like, share, and subscribe to the YouTube channel. And as usual, thanks for watching, and I'll see you in the next one. Thank you. Bye-bye.